This video discusses best practices for supporting trans and gender diverse patients after sexual assault.
I'm Dr. Ellie. My pronouns are she and her. My job is helping people after a sexual assault. Sexual assault is an issue that affects people of all genders, but it's important we consider how to specifically affirm and provide care to trans and gender diverse people who have experienced it. Before we begin, here's some basic terminology. Trans people are people whose gender is different to what was presumed at birth, as opposed to cis people whose gender is the same.
I'm trans and Dr. Ellie is cis. We are both women. Trans people can be men or women or non-binary gender.
Getting support after experiencing a sexual assault can be intimidating. This is especially true for trans and gender diverse people who already face many barriers when trying to receive quality care. Research shows that trans people experience sexual violence at very high rates. However, less than half tell someone about it, and fewer still seek medical assistance. Creating an environment that is inclusive, affirming, and welcoming is a big part of encouraging people to access support, including realizing that they qualify for receiving that support. Understanding why trans people are reluctant to access services is the first step to creating an affirming and safe environment. There are many reasons trans people might be worried about seeking help.
I'm scared that nobody will believe me about the assault, and even if they do, I'm worried they will not respect my gender, my pronouns, or could treat me as a woman.
Doctors sometimes talk about my body in ways that feel uncomfortable. Or worse, they've looked at or touched my genitals without my consent. I'd prefer not to see a doctor than go through that ever again.
Like many of my sisters, this isn't the first time I've been assaulted. Based on my previous experiences though, it's hard to know if I will be believed or shown any respect by doctors.
Trans people accessing healthcare often report feelings of powerlessness and shame. In my work, I've found trans people are incredibly resilient, but we still have a job to do to make accessing services as safe and easy as possible. It's important not to make assumptions, but to take the time to ask and listen, reassure and get consent as you go, so your trans patient feels in control and knows that they can say no or stop at any time. Being aware of the power dynamics within the clinical environment helps to not replicate the lack of control of a sexual assault when providing care.
Seeking help was really intimidating, but realizing it was a welcoming space made a big difference in deciding to go.
Knowing they believed me about what happened was a relief. It meant I felt safe talking about it.
It's easy to begin overcoming the service barriers trans and gender diverse people face. Visit TransHub for more information and resources.